My name is Naomi Vasquez, and I will be presenting on La Clínica de la Raza and its role in Chicano history. It is located in Oakland, California, the city I live in, and for this project I will be focusing on the main and first location branch. It is a community-based clinic founded in 1971 by a small group of UC Berkeley students who sought to fill the gap in healthcare for lower-income populations due to financial and language barriers. Along with the collaboration of several community members, they established a storefront clinic in Oakland, providing free medical services. In 1978, they began offering dental and optometry services and opened their first mental health site. In 1979, they opened their first community education site. And from 1980 through 2025, they expanded and opened many new clinics in Alameda, Contra Costa, and Solano counties in the Bay Area. They now have 25 service sites to date. As of the 2020 census, this was the population that identified as Hispanic or Latino and below the poverty line. Looking at this data, we might assume that Hispanics and Latinos and low-income families are not the predominant populations in Oakland. However, as an Oakland native, I know the truth. A large amount of the Oakland population is composed of immigrants that are low-income and Latinx, and they tend not to fill out the census due to fear of their information being exposed. The reality is that Oakland has predominantly been Latinx, largely Chicanx, and has had large low-income populations for many years now. La Clínica has grown into a regional, federally qualified health center network and provides culturally tailored and linguistically appropriate services such as primary care, women's health, HIV services, and WIC to diverse and medically underserved populations, which are predominantly the low-income Latinx population in Oakland. La Clínica's history is deeply tied to the Chicanx movement because it was founded in response to the inequalities raised during the 1960s to 70s around self-determination and justice for the Chicanx community. The Clínica has played a role in Chicanx history in Oakland by bridging many barriers in the community through language access, gender and trans-friendly services, and culturally relevant care. How has La Clínica served the Latinx trans community? We can see it through a study called Entre Nosotras, a qualitative study of a peer-led PrEP project for transgender Latinas in 2023 by Haas, Coester, Venegas et al. The authors evaluate the success of Triunfo, which is a peer-led project specifically designed to increase the low usage of HIV pre-exposure PrEP among Latina transgender women in the San Francisco Bay Area, which is a population that faces some of the highest rates of HIV. The project brought together HIV prevention services like PrEP with gender-affirming care at La Clínica de la Raza. The clinic served the predominantly low-income Latinx trans community and bridged barriers within those groups. This step played a huge role in Latinx healthcare because before it, healthcare centers did not focus much on serving the trans Latinx community in Oakland. However, La Clínica, through the project, was able to implement trans HIV aid, made it successful, and continued to use the approach in serving the trans community in the long term. Peer health educators who were transgender Latinas and native Spanish speakers took on an important part in the program because they led intervention activities and provided comprehensive patient navigation that not only helped them with medical care, but also with assistance with legal appointments, name changes, and managing personal crises. The research found that the intervention success in supporting participants to start and stay on PrEP stemmed from three elements, which were creating trusted spaces, offering detailed patient navigation, and fostering social support entre nosotras. The way they were able to successfully engage that marginalized group, which had previously avoided healthcare due to past experiences with transphobia and discrimination, was through the holistic, welcoming, and affirming client-centered approach that La Clínica de la Raza implemented. Apart from the study, how does La Clínica serve the trans and Latinx communities? They offer gender-affirming hormone therapy, behavioral health such as mental health support and wellness services, financial assistance for costs for gender-affirming gear and pharmacy supplies. They emphasize culturally competent care, including bilingual staff, and can integrate traditional Latin American and indigenous healing practices. Here are some pictures of La Clínica staff. And here are some quick facts, such as the percentage of patients at or below the 200% of federal poverty line, which was 93.3% in 2023, the total patients, percentage of uninsured patients. When comparing La Clínica to other private clinics in nearby wealthy communities, it is disadvantaged. For example, Peninsula Doctor is a private clinic in Menlo Park, California. In this clinic, patients pay for guaranteed same-day access, long visits, and personalized coordination. It differs greatly from La Clínica since at La Clínica, most patients need to wait longer for appointments to open up, and visits are fairly short and quick since there's many patients awaiting their turn. Peninsula Doctor is a concierge medical practice, meaning patients pay a membership fee for more personalized access. They do not accept Medicare, and insurance doesn't cover the concierge membership fee. La Clínica de la Raza, by contrast, is a nonprofit community health center, FQHC, that provides care regardless of a patient's ability to pay. Peninsula Doctor is much less about community outreach or serving marginalized populations. How does La Clínica relate to the story Woman Hollering Creek by Sandra Cisneros? In the story, Cleofilas visits a clinic. It is there that the nurse notices she is bruised and hiding something. Because the nurse speaks Spanish, she is able to help Cleofilas escape by letting her know that there is a way out and that she can run away. She calls her friend Feliz, and they arrange to drive Cleofilas far from her abusive home. If the clinic didn't have Spanish-speaking services or staff members that truly cared for their patients, Cleofilas probably would not have been able to escape her situation. Visiting the clinic was a huge significance in Cleofilas' story. It marks the beginning of hope and a new journey to her and her children. Similarly, La Clínica de la Raza offers that same type of care for all women. Women that might be going through similar struggles will receive the help they need because staff is attentive to signs of abuse. La Clínica has posters in their waiting rooms that have domestic abuse hotlines and other resources that might help women in abusive relationships. Because there is always Spanish-speaking services and guaranteed confidential visits at La Clínica, patients who only speak Spanish like Cleofilas can be more comfortable to speak up and ask for help without their partners knowing. Lastly, for this project, I visited La Clínica de la Raza to interview one Latinx patient who lives in Oakland and who receives medical services from La Clínica. The patient I interviewed is Angelica Abadio. She was born in Guatemala and immigrated to Oakland 6 years ago. She is a mom of 3, and her children have been patients for about 4 years now. Here are the interview questions I asked her.
Voy a la Clínica de la Raza porque ahí me siento más segura porque hablan español, y así entiendo bien y hago todas mis preguntas que quiero saber para entender bien y comprender bien todo lo que está pasando. También es más barato, el costo es más bajo, aceptan mi Medical y también está más segura, más cerca, está más cerca de mi comunidad y me siento más segura. Sí, yo he usado esos servicios, por ejemplo, cuando estaba embarazada, me trataron muy bien, me sentía cómoda, segura, y fue una experiencia muy bonita porque pues lo tratan a uno muy bien, lo atienden bien y todas nuestras preguntas, todas nuestras dudas nos las aclaran muy bien. Y también todas mis amigas han ido a la Clínica de la Raza y nos gusta mucho. Pues yo creo que la Clínica de la Raza ya ofrece todos esos servicios y todos lo sabemos, nos sentimos muy seguros ahí y pues todo está bien con los servicios.